Good morning, everybody. My topic for today is about mental health of nurses. I am Richmond Valledo, and I'll be walking you through this topic. So, the mental health of nurses during COVID-19 pandemic is a critical concern for the Canadian Healthcare Organization because it has a direct impact on the well-being and the ability to provide high-quality patient care. With this, nurses are experiencing severe psychological stress. Nurses must assess therapies to treat post traumatic stress disorder and other identified trauma related mental health concerns, which may be required now and in the future. Nurses' mental health can have an adverse effect on patient care, resulting in burnout and depression. Maintaining the mental well being of nurses and other healthcare professionals' psychological health must be protected and fostered to raise and preserve psychological levels of health and resilience, as well as to lessen the probability of developing the long term mental health disorders. I will be approaching this with three categories. First, a multifaceted approach. The shortages of nurses during the pandemic is a problem that I, as a future Canadian healthcare leader, will address. The availability of the mental health services would be um, improved by expanding the number of mental health nurses. With an increase in nurses' mental health, would make it possible for people to obtain the treatment they require and be seen more immediately. Second would be establishing a peer support program for mental health of nurses. Peer support can enhance the well being and resiliency of healthcare workers, especially nurses. It offers nurses a private and secure setting in which to discuss their concerns. Lastly, would be implementing a mentorship program. It has been shown to increase new nurses' retention in mental health setting. It would also assist nurses to better comprehend the psychological and emotional components of the pandemic and acquire the abilities they needed to give quality care by giving them the advice and support of the more seasoned colleagues. What are the leadership theories and styles that I will be using? First, it would be Roy's adaptation model of nursing theory. And it concentrates on how people adjust to changes in the environment. This model places a strong emphasis on the significance of comprehending how an individual perceives their environment as well as how they adjust to it. Second would be transformational leadership. We all know that transformational leaders inspires and motivates their followers to realize a common goal. Also involving mental health of nurses in putting suggested solutions into practice would be beneficial, like the mentorship and peer support program. Meanwhile, Kurt Lewin's model of change will be used in this research. First stage is the unfreezing, which the nurse leader will discover a useful technique to help the nursing staff let go of the ingrained habit that had elevated their stress. Second stage would be change. The nurse leader will incorporate the process of transformation in thoughts, feelings, and behaviors. Lastly, or the third stage would be refreezing, where the nurse leader helps make change become a new habit by highlighting strategies of maintaining the change. What are the expected outcomes and sustainability outlined on this research? First is the improvement of nurses' mental health, more job satisfaction, and better patient care are anticipated results of applying the three approaches that I said a while ago. Next would be spreading solutions through forums, like talking about the problems with mental health and spreading the word about how crucial mental health is. Also, next is by providing continued resources and support. Leaders can guarantee the sustainability of this program. This entails like allocating sufficient funds and resources for the initiative to guarantee that all resources are available for sustainability. They should also give workers with education and training, ensuring that staff members receive continual instruction and training, and fostering an environment of openness and trust. Lastly, leaders should also conduct a regular assessments, evaluations, and modifications to guarantee that the efforts are successful and should make any necessary adjustments. In conclusion, help may be required to improve and maintain mental health levels and resilience, as well as to reduce the risk of developing long term health problems. Finally, the success of the planning and implementation of the changes must be acknowledged by integrating them into the way things are typically done and strengthening and stabilizing them. These are all the references that I've used on this presentation. I hope you learn something new. Thank you.